Your body came with way more optional equipment than you realized. In 2025, medicine just updated the official list of what you can live without. We're talking about dozens of different organs and body parts that turned out to be biological spare parts, completely unnecessary but thrown in anyway. Take your appendix, for instance. That little troublemaker exists mainly to cause emergency room visits. From organs that sound absolutely vital to ones you've probably never even heard of, your biological architecture has more backups than a redundant computer system. But here's where things get really wild. We're not just talking about obviously expendable parts. Your brain, half of it's the ultimate backup plan. You can literally remove half of someone's brain and they'll still walk, talk, and live a completely normal life. This sounds like something out of a medical horror movie, but hemispherectomy procedures prove that our brains apparently order double portions of everything just in case. When severe epilepsy affects only one brain hemisphere, surgeons sometimes recommend removing that entire half to stop the seizures from spreading to healthy tissue. The procedure works exactly like it sounds. Surgeons disconnect or remove the problematic hemisphere while leaving the healthy side completely intact. This isn't some experimental treatment either. Doctors have been performing hemispherectomies since the 1920s, though modern techniques have made the surgery far more precise. In 2025, success rates have climbed to impressive heights, with up to 90% of patients achieving complete seizure control compared to the 50–70% rates seen in earlier decades. Advanced imaging technology now allows surgeons to map brain functions beforehand, ensuring they preserve as much healthy tissue as possible during the procedure. The remaining hemisphere transforms into a neurological overachiever, taking on responsibilities it was never originally assigned. Language centers relocate, motor functions rewire themselves, and cognitive processes find new pathways through healthy brain tissue. This adaptation happens because neurons form new connections at an accelerated rate following the surgery. The brain essentially reprograms itself like biological software receiving a major update. 2025 surgical reports describe teens regaining speech and mobility post-hemispherectomy, with some returning to normal school activities within months. The brain's plasticity allows the remaining hemisphere to completely take over language processing, even when functions typically handled by the removed side. Another documented case involves a young adult who lost his right hemisphere but regained most motor control within a year and returned to work as a computer programmer. Age plays a crucial role in determining outcomes. Studies show children under 15 recover more functions thanks to stronger brain plasticity. Neural pathways remain flexible enough to reroute around missing areas, essentially creating biological detours. Adult patients face more challenges, but many still achieve excellent results. The brain's plasticity decreases with age, but it never disappears entirely. Even 40-year-old patients have shown significant recovery, though the process takes longer than it would for younger individuals. Doctors don't recommend hemispherectomies lightly. The decision requires extensive evaluation by neurologists, neurosurgeons, and neuropsychologists. Patients undergo months of testing to confirm that seizures originate from one hemisphere and that the other side can handle full brain functions. The procedure carries risks including infection, bleeding, and potential cognitive changes. However, when seizures severely impact quality of life and resist all other treatments, removing half the brain often provides the best chance for normal functioning. This makes you wonder what exactly we need all that brain space for anyway. If half a brain handles everything necessary for normal life, the other half seems like neurological excess baggage. Evolution apparently gave us backup plans for our backup plans, installing redundant systems throughout our skulls like the world's most overcomplicated computer network. But the brain isn't the only organ that came with suspicious amounts of extra capacity. One lung because two is just showing off. Your lungs apparently came with the same redundancy philosophy. Studies show surviving athletes even complete marathons with one lung, which sounds like something that should be physically impossible until you realize our respiratory system came with way more capacity than we actually use. Pneumonectomy procedures remove an entire lung when diseases like cancer, chronic obstructive pulmonary disease, or tuberculosis destroy lung tissue beyond repair. Surgeons cut through the chest wall, disconnect all blood vessels and airways leading to the diseased lung, then remove the entire organ in one piece. The operation sounds devastating, but patients regularly walk out of hospitals weeks later breathing normally through their remaining lung. The remaining lung immediately begins expanding like a biological balloon, filling the empty chest cavity. Other organs play an elaborate game of musical chairs, shifting positions to accommodate the lung's growth. The heart tilts slightly toward the surgical side, the diaphragm rises to fill some space, and the remaining lung stretches across areas it never occupied before. This internal reorganization happens automatically as the body adjusts to its new configuration. Current 2025 data shows remarkable improvements in pneumonectomy outcomes compared to previous decades. 5-year survival rates now exceed 85% for patients with early-stage lung cancer who undergo the procedure, while quality of life measurements show most people return to their pre-surgery activity levels within 6 months. Modern surgical techniques in postoperative care have dramatically reduced complications that once made single lung living more challenging. The remaining lung undergoes fascinating structural changes to handle increased workload. Alveoli, the tiny air sacs where oxygen enters the bloodstream, expand significantly to process more air with each breath. Animal studies show lungs can grow new alveoli. In children, the remaining lung can partially regenerate. Adult patients don't grow new alveoli, but their existing ones stretch and enlarge to move substantially more air through the respiratory system. Athletes prove daily that single-lung performance exceeds most people's expectations. Marathon runners, cyclists, and even mountain climbers have achieved impressive athletic accomplishments with only one functioning lung. These individuals demonstrate that respiratory limitations exist more in our assumptions than in biological reality. Their success stories show that 2 lungs might represent evolutionary overkill rather than essential equipment. The remaining lung handles approximately 70 to 80% of normal respiratory function, which turns out to be plenty for virtually all daily activities. This capacity allows people to climb stairs, exercise vigorously, and engage in physically demanding work without significant limitations. The 20 to 30% reduction barely affects most activities, making that second lung seem like respiratory luxury rather than necessity. This makes those gasps during a sprint might be more about performance than necessity when you consider people with half the lung capacity manage the same activities. New 2025 rehabilitation programs focus on breathing efficiency rather than compensation techniques. Patients learn specific exercises that maximize airflow through their remaining lung, including diaphragmatic breathing patterns and controlled exhalation methods. These techniques help people optimize their reduced respiratory capacity and return to normal activity levels faster than traditional recovery approaches. Having 2 lungs resembles owning a backup generator that never gets used because the main power supply handles everything perfectly well. But lungs aren't the only organs that seem suspiciously over-engineered for their actual job requirements. Your appendix evolution's biggest oops. The appendix stands as one of medicine's most controversial organs, recently earning recognition for potential immune functions despite its reputation as evolution's biggest mistake. This small, finger-shaped pouch attached to your large intestine has puzzled doctors for centuries, earning a reputation as the body's most troublesome tenant. Scientists have spent decades trying to figure out why evolution bothered keeping this apparent biological dead weight around when it causes so many problems. Traditional medical thinking classified the appendix as a vestigial organ, essentially evolutionary leftovers from our ancient plant-eating ancestors. The theory suggested that early humans needed larger digestive systems to process tough plant materials, and the appendix represented a shrunken remnant of what used to be a much larger structure. This explanation made the appendix sound like biological junk mail that never got thrown away, just sitting there taking up space until it inevitably caused trouble. Recent research has turned this understanding completely upside down. Researchers hypothesize it acts as a safe house for beneficial bacteria, supported by studies linking removal to C. difficile recurrence. This theory proposes that the appendix protects good bacteria during illness or antibiotic treatments that wipe out normal gut flora. When your digestive system needs to rebuild its bacterial population, the appendix releases its stored reserves to help repopulate your intestines with healthy microorganisms. Supporting this theory, a 2017 study examined 533 mammal species and discovered that appendixes appear across multiple unrelated species, suggesting this organ serves an important function rather than representing evolutionary waste. The widespread presence of appendixes throughout the animal kingdom indicates that nature wouldn't keep something around unless it provided real benefits. Appendectomy procedures remove the inflamed appendix through small incisions, making this surgery one of the most commonly performed emergency operations. Modern laparoscopic techniques allow surgeons to extract the appendix through tiny cuts rather than large abdominal incisions. Most patients with early appendicitis can return home the same day or after one night in the hospital, though more severe cases require extended stays for intravenous antibiotics. Current statistics show that about 10% of the population per Harvard Health face appendicitis and the rest live without issues. The condition strikes most frequently between ages 10 and 19, though it can occur at any age with various unknown triggers contributing to inflammation. Modern surgical outcomes have improved dramatically, with complications becoming increasingly rare as techniques advance. The scientific debate continues over whether the appendix deserves its reputation as useless or misunderstood. Some researchers point to studies showing that people without appendixes face higher risks of recurring Clostridium difficile infections, suggesting the organ does provide protective benefits. Other scientists remain skeptical, arguing that any benefits don't justify the risks of keeping an organ prone to dangerous inflammation. Whether the appendix proves useful or useless, millions of people demonstrate daily that life continues perfectly well without it, making this evolutionary puzzle completely optional equipment. But the appendix isn't the only organ that causes disproportionate trouble for something the body apparently doesn't actually need. Gallbladder, the body's most overrated storage unit. The gallbladder creates absolutely massive amounts of pain for something you can remove and forget about completely. This tiny organ sits quietly under your liver for years, doing its modest job of storing bile, until one day it decides to ruin your life with excruciating pain that sends you straight to the emergency room. For such a small storage pouch, it certainly knows how to make a dramatic exit. The gallbladder functions as bile storage facility, holding the digestive fluid your liver produces until your small intestine needs it to break down fats. This seemed like brilliant biological engineering when evolution designed it. Your liver continuously produces bile, but you don't eat constantly, so having a storage tank to hold bile between meals appeared to solve a practical problem. The gallbladder concentrates this bile, making it more potent when your digestive system calls for backup during fatty meals. Gallstones form when bile components like cholesterol, bile salts, and bilirubin crystallize inside the gallbladder, creating hardened deposits that behave like biological kidney stones with attitude problems. These stones can range from tiny grains to golf ball-sized chunks that block bile ducts and cause inflammation. Unlike kidney stones that eventually pass through your system, gallstones often refuse to leave peacefully, instead camping out and causing chronic problems that require surgical intervention. Cholecystectomy procedures have evolved dramatically through minimally invasive laparoscopic techniques that require only small incisions rather than large abdominal cuts. Surgeons insert tiny cameras and instruments through these small openings, allowing them to remove the gallbladder while patients recover much faster than with traditional open surgery. Most modern patients recover within days, per Harvard Health, going home the same day or after one overnight hospital stay, compared to week-long recoveries from older surgical methods. In 1882, a German surgeon removed a gallbladder, noting mammals thrive without it. This early surgical pioneer essentially looked around the animal kingdom, noticed that most creatures managed digestion perfectly well without bile storage tanks, and concluded humans could probably do the same. His logic proved remarkably sound. Bile delivery functions perfectly without the storage middleman, operating like switching from warehouse distribution to direct shipping. Your liver simply sends bile straight to your small intestine whenever food arrives, eliminating the need for temporary storage. This direct delivery system works so efficiently that most people never notice the difference in their digestion. It's a storage tank evolution no longer needs, creating an extra step in bile distribution that adds complexity without improving efficiency. Like corporate middle management, it occasionally causes problems while providing questionable value to overall operations. Dietary adjustments after gallbladder removal remain minimal, with most people resuming normal eating habits within weeks. Doctors might suggest avoiding extremely fatty meals immediately after surgery, but the digestive system adapts quickly to direct bile delivery. Many patients report feeling better than they had in years once their problematic gallbladder stops causing pain and inflammation. This proves that sometimes the body's filing system benefits from decluttering, removing unnecessary components that create more problems than solutions. But storage isn't the only job the body assigns to organs that turn out to be surprisingly replaceable. Spleen, your blood's bouncer you can fire. Your spleen works as the blood's quality control manager, filtering out damaged red blood cells and producing infection-fighting white blood cells, yet this seemingly essential organ can be completely removed without destroying your health. This fist-sized organ sits in your upper left abdomen, constantly screening your blood supply like a biological security checkpoint. Despite performing these critical functions, the spleen turns out to be surprisingly expendable when medical circumstances require its removal. Splenectomy procedures often happen during emergency situations when trauma ruptures the spleen and causes life-threatening internal bleeding. Car crashes, falls, and severe abdominal impacts can tear this organ, forcing surgeons to remove it completely to save the patient's life. The spleen also gets removed when infections cause it to enlarge dramatically, trapping and destroying healthy blood cells faster than the body can replace them. During these emergency surgeries, doctors prioritize stopping the bleeding over preserving the organ, proving that immediate survival matters more than keeping every body part intact. The spleen's functions sound absolutely essential when you examine what it actually does inside your body. This organ filters blood continuously, removing old or damaged red blood cells and recycling their components for future use. It also serves as a major production center for white blood cells that fight infections throughout your body. The spleen stores platelets needed for blood clotting and helps regulate blood volume by holding extra blood in reserve. These responsibilities make the spleen seem like a critical component that your body couldn't possibly function without. Current 2025 data reveals impressive outcomes for people living without their spleen, with most patients maintaining normal activity levels and good overall health. Long-term studies show that splenectomy patients adapt well to life without this organ, experiencing minimal impact on their daily functioning. Modern surgical techniques have reduced complications significantly, with laparoscopic procedures allowing faster recovery times and smaller incisions compared to traditional open surgery methods. Other organs step up to handle the spleen's responsibilities when it gets removed, particularly the liver, which takes over most blood filtering duties. Your liver already processes enormous amounts of blood daily, so adding the spleen's filtering workload doesn't overwhelm this multitasking organ. Lymph nodes throughout your body also increase their activity to compensate for the missing immune functions, maintaining your body's infection-fighting capabilities through distributed security rather than centralized control. Splenectomy does increase infection risk, especially from certain bacteria that the spleen normally handles effectively. Post-splenectomy infection risk is now prevented via vaccines and antibiotics through preventive measures that boost immunity against specific organisms. Patients receive pneumococcal, meningococcal, and Haemophilus influenzae vaccines before or after surgery to strengthen their defenses against these particular threats. Athletes and professionals regularly demonstrate that normal, active lives continue without a spleen. Professional football players have returned to competition after splenectomy, while marathon runners and other endurance athletes maintain their performance levels. These examples prove that losing this organ doesn't prevent you from pursuing demanding physical activities or careers. Your liver becomes the new filter after splenectomy, proving capable of managing both its original duties and the additional responsibilities. New 2025 guidelines emphasize comprehensive vaccination schedules and infection monitoring protocols for post-splenectomy patients, making spleen removal far safer than in previous decades. This biological filter, while helpful for blood security, proves replaceable through the body's distributed defense network. But the spleen isn't the only organ that comes in pairs when you apparently only need one. One kidney, nature's built-in redundancy system. Kidneys demonstrate this redundancy principle perfectly, with living kidney donation proving that we literally have a spare filtration system just sitting around waiting for its moment to shine. Your body installed two complete filtration systems when one would handle the job perfectly well, like buying two identical water filters for a single faucet. This biological redundancy makes living kidney donation possible, allowing healthy people to give away an entire organ while continuing their normal lives with zero functional impact. Kidneys operate as your body's filtration system, processing about 150 liters of blood daily to remove waste products and excess water. Each kidney contains roughly 1 million tiny filtering units called nephrons that screen blood continuously, separating useful substances from toxic waste. Having two kidneys performing this work seems like massive overkill when you consider that one kidney easily handles about 70–75% of normal function without breaking a sweat. The kidney donation process involves surgically removing a healthy kidney from a living donor and transplanting it into someone whose kidneys have failed. Donors undergo extensive medical and psychological evaluation to ensure they can safely live with one kidney. The actual surgery typically takes 2–4 hours, with donors usually returning home within a few days. Most donors resume normal activities within 4–6 weeks and experience no long-term health problems from having one kidney instead of two. Current 2025 statistics show remarkable success rates for living kidney donation, with over 98% of donors maintaining excellent health years after surgery. Long-term studies tracking donors for decades reveal no increased risks of kidney disease, heart problems, or shortened lifespan compared to people with two kidneys. Some donors report completing endurance events post-donation, highlighting remarkable adaptation. These outcomes prove that nature's redundancy planning far exceeds our actual biological requirements. The remaining kidney's nephrons enlarge to compensate when one kidney is removed, with the other kidney's filtering units getting bigger so they can each do more work. This adaptation happens gradually over several months, with a single kidney eventually becoming just as effective as two kidneys would be. The process resembles upgrading computer software to handle increased processing demands, except your kidney performs this upgrade automatically. Kidney recipients sometimes keep their original failed kidneys during transplant surgery, ending up with 3 total kidneys in their bodies, though only the new one does the actual work. Surgeons often leave the diseased kidneys in place because removing them would complicate the operation unnecessarily. The new kidney gets placed in the lower abdomen rather than where the original kidneys sit, creating this unusual 3-kidney situation that functions perfectly well. This creates an interesting medical paradox where kidney failure threatens life while simultaneously proving that one kidney provides perfectly adequate function. People die from kidney failure not because they need two kidneys to survive, but because they need at least one functioning kidney. The difference between 0 working kidneys and 1 working kidney means the difference between life and death, while the difference between 1 and 2 working kidneys is essentially meaningless for daily health. New 2025 developments in kidney transplant procedures include improved surgical techniques and better donor screening methods that have made the process safer and more efficient than ever before. This built-in redundancy system proves our bodies came equipped with spare parts we didn't realize we needed, though some organs serve functions that extend beyond basic survival requirements. Reproductive organs' life goes on without the baby factory. Reproductive organs present a different category entirely, where removal affects biological functions beyond basic survival. The uterus and ovaries serve distinct reproductive purposes, but people can continue living full, healthy lives after their removal when medical conditions threaten overall health. This medical reality separates reproductive function from basic survival needs, allowing doctors to prioritize patient health over reproductive capacity when circumstances require such procedures. The uterus, designed specifically for carrying pregnancies, becomes expendable when serious medical conditions develop. In the US, over 600,000 hysterectomies occur annually, making it the second most common surgery among women. Hysterectomy procedures remove the uterus to address conditions including uterine fibroids, endometriosis, and various cancers. These surgeries become medically necessary when conditions cause severe pain, excessive bleeding, or pose cancer risks that outweigh the benefits of keeping reproductive organs intact. The decision requires careful evaluation of each patient's specific medical situation, considering both immediate health risks and long-term consequences. Ovaries present a more complex situation because they produce essential hormones throughout the body. When ovaries are removed along with the uterus, estrogen and progesterone production stops abruptly, creating hormonal imbalances that affect multiple body systems. These hormonal changes can cause hot flashes, mood swings, bone density loss, and other symptoms that impact quality of life. The timing and extent of reproductive organ removal determines the severity of hormonal disruption and influences treatment approaches. Current 2025 data shows substantial improvements in surgical techniques and patient outcomes for reproductive organ removal procedures. Minimally invasive laparoscopic and robotic-assisted surgeries have become increasingly common, offering patients smaller incisions, reduced pain, and faster recovery times compared to traditional open surgery methods. These advanced surgical approaches have made reproductive organ removal less traumatic for patients, while maintaining excellent success rates for treating underlying medical conditions. Hormone replacement therapy has advanced significantly by 2025, providing improved quality of life options for patients after reproductive organ removal. Modern HRT approaches offer more personalized treatment plans that address individual patient needs and minimize side effects. These therapies help manage symptoms like hot flashes, mood changes, and bone density loss that result from sudden hormone level changes. The effectiveness of hormone replacement varies among individuals, but current treatments provide better symptom control than previous generations of therapy. Healthcare providers recognize the emotional complexity of reproductive organ removal, offering comprehensive support that addresses psychological and physical aspects of recovery. The loss of fertility represents a significant life change that requires careful counseling and support systems. Discussions about body image, sexuality, and future family planning become integrated parts of patient care plans. Recovery protocols emphasize holistic approaches including pain management, physical therapy, and emotional support services. People adapt remarkably well to life after reproductive organ removal, maintaining normal activities and pursuing personal and professional goals. Many patients report feeling better after surgery than they did while dealing with painful or dangerous reproductive health conditions. Support systems including counseling and support groups help patients navigate the emotional and physical changes that accompany these procedures. While reproductive functions serve important biological purposes, individual health and survival continue successfully without them when medical circumstances require their removal. But reproductive organs aren't the only body parts that seem more essential than they actually are when it comes to daily functioning. Stomach, the overrated food processor. Your stomach represents another organ that challenges basic assumptions about digestive necessity. You can live without a stomach, though patients must eat small meals frequently, and dumping syndrome is managed via diet adjustments. The stomach appears absolutely essential for breaking down food and storing meals between eating sessions, yet thousands of people function well after complete stomach removal. This revelation shows that some organs we consider vital actually serve more as biological conveniences. Total gastrectomy procedures remove the entire stomach when medical conditions like advanced stomach cancer, severe ulcers, or gastric tumors threaten patient survival. Surgeons disconnect the stomach from both the esophagus above and the small intestine below, then remove the entire organ from the abdominal cavity. Following removal, they create a direct connection between the esophagus and small intestine, essentially creating a straight pipeline from throat to digestive tract. The small intestine handles most digestion, with studies showing 70–80% of nutrient processing occurs downstream from the stomach. Your small intestine contains millions of tiny projections called villi that absorb nutrients from food, performing the real heavy lifting in digestion. The stomach's main contributions include acid production for protein breakdown and temporary food storage, but the small intestine can manage without these preprocessing steps. Current 2025 statistics show encouraging outcomes for total gastrectomy patients, with 5-year survival rates exceeding 70% for early-stage stomach cancer cases. Modern surgical techniques have reduced complications significantly, with laparoscopic and robotic-assisted procedures offering faster recovery times and smaller incisions. Patients usually return to normal within 6–8 weeks after surgery, demonstrating remarkable adaptation to life without stomach storage capacity. The esophagus connects directly to the small intestine after stomach removal, creating a more streamlined digestive system that eliminates the middleman. Food travels straight from the throat into the small intestine, where immediate digestion begins without preliminary stomach processing. This direct connection functions like upgrading from a complex multi-stage manufacturing process to a simplified assembly line that produces the same results. Dietary adjustments become necessary after gastrectomy, requiring patients to eat smaller, more frequent meals instead of traditional 3-meal schedules. Without stomach storage capacity, large meals would overwhelm the small intestine and cause discomfort. Patients typically eat 6–8 small meals daily, consuming the same total calories but distributing them more evenly throughout the day. Vitamin supplementation becomes essential, particularly vitamin B12 and vitamin D, because the small intestine absorbs these nutrients less efficiently without stomach acid assistance. Dumping syndrome represents the most common side effect after stomach removal. Sugars rapidly enter the small intestine, causing fluid shifts and symptoms after meals including cramping, bloating, nausea, weakness, and dizziness. Modern medicine has improved dumping syndrome management through dietary modifications and medications that slow food transit through the digestive system. People living without stomachs maintain active lifestyles by planning meals carefully and following prescribed dietary strategies. They consume adequate calories through frequent small meals and manage their nutrition successfully with medical guidance. The stomach proves that even organs handling fundamental processes like digestion can be surprisingly optional when other body systems step up to compensate. Adenoids, the immune system's unnecessary backup singers. Moving beyond digestive systems, adenoids represent immune tissues that frequently interfere with basic functions like breathing and sleeping. These lymphoid structures sit behind your nose and the upper throat, working alongside tonsils to catch germs entering through your mouth and nose. When adenoids function properly, they help identify and fight off potential infections before they spread deeper into your system. Adenoidectomy procedures involve surgically removing enlarged or infected adenoid tissue, typically performed when these structures cause more harm than protection. Surgeons access adenoids through the mouth using specialized instruments like curettes or microdebriders to carefully remove the problematic tissue. The procedure often gets combined with tonsillectomy, since both organs frequently cause similar problems simultaneously. Modern endoscopic techniques allow surgeons clearer views of the surgical area, leading to more precise tissue removal and reduced complication risks. Enlarged adenoids create significant breathing difficulties, particularly during sleep when relaxed throat muscles make airway obstruction worse. Children with swollen adenoids often snore loudly, breathe through their mouths constantly, and develop obstructive sleep apnea that disrupts their rest. These breathing problems cascade into daytime sleepiness, behavioral issues, and concentration difficulties that affect school performance and social interactions. Chronic nasal congestion from blocked adenoids also leads to recurring ear infections as fluid builds up behind eardrums. Current 2025 statistics show adenoidectomy remains extremely common, especially among children experiencing recurrent ear infections and sleep-disordered breathing. A Danish study found significant reductions in infections and hospitalizations post-adenoidectomy. Recovery outcomes prove consistently positive, with most patients experiencing dramatic improvements in sleep quality and breathing function within weeks of surgery. Postoperative complications remain rare, though they can include bleeding, infection, or temporary voice changes that typically resolve during the healing process. The immune system compensates when adenoids are removed through other lymphoid tissues, including lymph nodes throughout your body, that easily handle the adenoid's former responsibilities. This extensive network means losing one component doesn't create significant long-term vulnerabilities in most individuals. Adenoids and tonsils work together as your body's first line of immune defense, both composed of lymphoid tissue designed to trap and eliminate infections entering through your mouth and nose. When both structures get removed simultaneously, other lymphoid tissues throughout your body maintain adequate protection against pathogens. Adenoid removal often produces dramatic improvements in sleep quality, especially for children whose enlarged tissues block normal breathing patterns. Parents frequently report that their children sleep more peacefully, snore less, and wake up more rested after adenoidectomy procedures. These sleep improvements translate into better behavior, enhanced cognitive function, and improved overall health that affects every aspect of daily life. Your immune system has backup lines ready when adenoids step aside, proving these tissues aren't as essential as their prominent location suggests. New 2025 surgical techniques emphasize precision removal methods and improved recovery protocols that minimize post-operative discomfort while maximizing positive outcomes. But some organs take biological backup systems to an entirely different level, demonstrating capabilities that seem to defy everything we understand about human limitations. Part of the liver is the ultimate regenerating organ. The liver takes regenerative abilities to an entirely different level through capabilities that seem almost impossible until you witness them in medical practice. You can donate most of your liver, and it will literally grow back through hepatocyte replication, which represents one of the few true regenerative capabilities in human organs. This extraordinary ability makes living liver donation possible, allowing healthy people to give away substantial portions of their liver while keeping enough for themselves to survive and thrive. Partial hepatectomy procedures remove diseased sections of liver or harvest healthy tissue for transplantation into recipients whose livers have failed. Surgeons can safely remove up to 65% of a healthy liver, leaving the donor with just over one-third of their original organ. The remaining liver tissue immediately begins the regeneration process, growing new hepatocytes to replace what was removed. Living liver donation typically involves removing the right lobe, which contains about 60% of the liver's total mass, though surgeons sometimes take smaller sections depending on recipient needs and donor anatomy. No other organ regenerates to original volume like the liver. The liver's incredible regenerative abilities stem from hepatocytes, specialized cells that normally remain dormant until damage occurs. When liver tissue gets removed, these hepatocytes reactivate and begin dividing rapidly to replace missing cells. Unlike other organs that form scar tissue when damaged, the liver rebuilds itself with fully functional tissue that performs all normal liver functions. This regeneration process happens automatically without any medical intervention, driven by internal signals that detect reduced liver mass and trigger cellular reproduction. Current 2025 statistics show remarkable success rates for liver donation and regeneration, with donor survival rates exceeding 99% and regeneration typically completing within 8-12 months. Over 1,000 living liver donations occurred in 2023 in the US, demonstrating the growing success of this procedure. Modern surgical techniques have reduced complications significantly, with most donors returning to normal activities within 6-8 weeks after surgery. The regenerated liver tissue functions identically to original liver cells, processing toxins, producing proteins, and manufacturing bile with the same efficiency as before donation. To 65% of the liver can be safely removed and will show 25% growth within 1 year, making this organ unique among human body parts. The regeneration timeline varies among individuals, but most people see substantial liver growth within the first few months after surgery. Younger donors typically regenerate faster than older ones, though adults of all ages demonstrate impressive regenerative capacity that restores normal liver function completely. The liver performs numerous vital functions including detoxification, protein synthesis, and production of biochemicals necessary for digestion, making its regenerative ability crucial for survival. This organ processes everything you eat or drink, neutralizes toxins, produces blood-clotting proteins, and manufactures bile for fat digestion. Without adequate liver function, these essential processes fail rapidly, making liver regeneration a life-or-death capability. Successful liver donors and recipients demonstrate the life-saving potential of this regenerative miracle, with thousands of people living normal lives after giving or receiving partial liver transplants. This ultimate regenerating organ proves our bodies possess remarkable backup systems, though other organs rely on different strategies for maintaining function when parts get removed. Some lymph nodes, the immune system's expendable security guards. Lymph nodes function as the immune system's security checkpoints stationed throughout your body, But these small bean-shaped structures can be removed when medical circumstances require it without destroying your overall immune defenses. These nodes work like biological filters, screening lymph fluid for dangerous pathogens, cancer cells, and other threats that might harm your body. When everything works normally, lymph nodes trap these unwanted substances and eliminate them before they can spread to other areas, making them seem absolutely essential for staying healthy. Lymph node removal procedures happen frequently during cancer treatment when doctors need to prevent cancer cells from spreading through the lymphatic system to other body parts. Surgeons remove lymph nodes from areas where cancer might have traveled, examining them under microscopes to determine whether the disease has spread beyond the original tumor site. This removal process, while necessary for cancer treatment, essentially eliminates some security checkpoints from your body's surveillance network. Lymph nodes filter lymph fluid continuously, catching pathogens and abnormal cells as they flow through your lymphatic system. This filtering process involves specialized immune cells that live inside the nodes, examining everything that passes through and destroying anything that shouldn't be there. The nodes also produce white blood cells that help fight infections throughout your body, making them active participants in immune surveillance rather than passive filters. Current 2025 data shows encouraging outcomes for lymph node removal, with most patients maintaining effective immune function despite having fewer nodes than they started with. Modern surgical techniques have improved significantly, reducing complications while preserving as much healthy lymphatic tissue as possible. Patients typically recover well from these procedures, though they face slightly increased infection risks in areas where nodes were removed. Other lymph nodes pick up slack when some get removed, with remaining nodes and lymphatic vessels taking over the missing components' responsibilities. Your body contains hundreds of lymph nodes distributed throughout different regions, creating redundant security networks that can handle increased workloads when some checkpoints disappear. Other lymphatic structures step up their activity to maintain adequate immune surveillance despite reduced node numbers. Lymphedema represents the most significant potential complication from lymph node removal, occurring when lymph fluid builds up in tissues because drainage pathways have been disrupted. In breast cancer surgery, up to 25% may develop lymphedema without nodes. This swelling can affect arms, legs, or other body parts depending on which nodes were removed. Modern medicine manages lymphedema through compression therapy, specialized exercises, and manual lymphatic drainage techniques that help redirect fluid flow through collateral lymphatic pathways. People adapt successfully to life with fewer lymph nodes while maintaining immune function, though they must take additional precautions against infections. These individuals learn to recognize early infection signs and seek prompt medical treatment when symptoms appear. Regular monitoring and preventive care help manage the increased infection risks that come with reduced lymphatic surveillance. New 2025 surgical techniques emphasize preserving lymph nodes whenever possible, using methods like sentinel lymph node biopsy that remove only the most critical nodes for cancer staging. Your immune system has multiple checkpoints that demonstrate remarkable adaptability when some components get removed. But some organs handle even more fundamental biological processes that seem impossible to replace artificially. Thyroid gland, the metabolic manager you can replace. The thyroid gland serves as your body's metabolic manager, controlling energy production and hormonal balance throughout your entire system. Yet the seemingly essential organ can be completely removed with proper hormone replacement therapy, keeping everything running smoothly. This butterfly-shaped gland sits in your neck, producing hormones that regulate how fast your cells burn energy, maintain body temperature, and coordinate growth processes. Despite controlling such fundamental functions, the thyroid proves completely replaceable through modern medical intervention. Thyroidectomy procedures remove part or all of the thyroid gland when medical conditions threaten patient health. Surgeons perform total thyroidectomies for thyroid cancer, removing the entire gland to prevent cancer spread throughout the body. Hyperthyroidism cases sometimes require complete removal when the overactive thyroid produces dangerous hormone levels that medications cannot control. Large goiters that interfere with breathing or swallowing also necessitate surgical removal. The procedure involves making a small incision across the lower neck, carefully disconnecting blood vessels and nerves, then extracting the problematic thyroid tissue. Most patients return to normal activities within 4-6 weeks post-thyroidectomy. The thyroid's primary job involves producing two crucial hormones called thyroxine and triiodothyronine, which influence nearly every cell in your body. These hormones act like metabolic accelerator pedals, telling cells how quickly to burn fuel and generate energy. They regulate heart rate, body temperature, digestive speed, and brain function. Without thyroid hormones, your metabolism would slow to dangerous levels, causing fatigue, weight gain, depression, and potentially life-threatening complications. Thyroid removal procedures have become increasingly common as hormone replacement therapy proves highly effective at maintaining normal bodily functions. The rising prevalence of thyroid conditions and the success of synthetic hormone treatments have made thyroidectomy a viable option for many patients facing serious thyroid diseases. Modern surgical techniques have reduced complications while improving recovery times for people undergoing these procedures. Synthetic thyroid hormones like levothyroxine completely replace natural thyroid function when properly managed. Levothyroxine is synthetic thyroxine that your body converts into the active hormone form, mimicking normal thyroid processes. This medication effectively maintains normal metabolism and quality of life when dosages are correctly calibrated. Synthetic levothyroxine replaces natural thyroid hormones. Dosing adjustments maintain normal metabolism through precise pharmaceutical control. Proper hormone level monitoring requires regular blood tests to measure thyroid hormone concentrations and adjust synthetic hormone dosages accordingly. TSH levels guide dosing per Harvard endocrine guidelines, helping doctors fine-tune replacement therapy. Doctors check these levels every few months initially, then less frequently once optimal doses are established. This monitoring prevents both underactive and overactive thyroid symptoms, ensuring patients maintain stable metabolism and avoid complications. People living with synthetic thyroid hormone replacement maintain completely normal active lifestyles. They participate in all previous activities, maintain healthy weights, and experience normal energy levels when their hormone therapy is well managed. Lifelong monitoring is required, but quality of life equals pre-surgery levels for most patients. Athletes, professionals, and active individuals continue their demanding schedules without limitations imposed by their missing thyroid gland. New developments in thyroid hormone therapy include more accurate blood tests, personalized dosing strategies, and improved hormone formulations that enhance patient outcomes. These advances continue improving the management experience for people without thyroid glands. This metabolic manager proves that modern medicine can successfully outsource some biological functions, demonstrating our ability to replace nature's original equipment with reliable pharmaceutical alternatives. But some organs take a completely different approach to becoming unnecessary. Thymus, the immune trainer that retires early. The thymus operates as your immune system's trainer during childhood, but this organ naturally shrinks with age anyway, making it basically self-retiring biological equipment. Located behind your breastbone in the upper chest, the thymus works overtime during your early years to educate T cells about proper immune responses. By the time you reach adulthood, this trainer has already done its job and starts packing up shop whether you want it to or not. Thymectomy procedures involve surgically removing the thymus gland, primarily performed to treat myasthenia gravis, an autoimmune condition where the thymus contributes to muscle weakness by producing antibodies that attack nerve muscle connections. The thymus sits directly in front of the heart, so cardiac surgeons sometimes remove it during complex heart operations when they need clear access to cardiac structures, though this represents a secondary consideration rather than the primary indication for removal. The thymus serves as the immune system's educational facility, where T cells learn to distinguish between your body's healthy cells and dangerous foreign invaders. This training process prevents autoimmune diseases by teaching immune cells not to attack your own tissues. The thymus produces hormones that guide T cell development and ensures these infection-fighting cells mature properly before entering circulation throughout your body. Without proper thymic education, T cells might attack healthy organs or fail to recognize genuine threats. Current 2025 data reveals that thymus removal in adults produces minimal long-term immune system effects, with most patients maintaining adequate infection-fighting capabilities. The liver and other lymphoid tissues compensate effectively for the missing thymus, taking over many of its former responsibilities in immune surveillance and T-cell support. Vaccines help manage slightly increased infection risk through preventive measures that boost immunity against specific organisms. The thymus demonstrates peak activity during childhood when your immune system requires extensive education about potential threats. Children's thymuses work constantly to produce and train new T cells, establishing immune memory that lasts throughout life. As people age, the thymus naturally undergoes involution, shrinking significantly and reducing T cell production. By age 50, most people have very little active thymic tissue remaining, proving this organ expects early retirement. Thymus removal in adults has minimal impact on immune function because the educational work was completed decades earlier. Adult immune systems rely more on established T cell populations and immune memory than on continuous thymic training. Younger patients who undergo thymectomy may experience more significant effects since their immune systems haven't finished developing, though they typically adapt well through compensatory mechanisms in other lymphoid organs. People adapt successfully to life without a thymus regardless of age, maintaining normal daily activities and healthy immune responses. Adults show virtually no difference in immune function after thymectomy, while children develop adequate immune competence through alternative pathways. The body's remarkable ability to compensate proves that this trainer, while important early on, becomes expendable once basic immune education is complete. New 2025 research explores thymus regeneration possibilities and examines how other organs assume thymic functions after removal. Scientists investigate whether therapeutic interventions might restore some thymic activity in older adults to boost immune function. This early retiring trainer demonstrates that some organs come with built-in planned obsolescence, designed to work intensively during critical periods before gracefully stepping aside. But other immune tissues take a completely different approach, positioning themselves as permanent security guards that sometimes create more problems than they solve. Tonsils, the throat's overzealous security team. Tonsils represent a different category of throat defenders that frequently transform from protectors into problems. These oval-shaped tissues sit on either side of your throat, designed to catch germs entering through your mouth and nose before they spread deeper into your body. When functioning properly, tonsils help your immune system identify threats and mount appropriate responses. However, sometimes these guards mistook friendly visitors for enemies, becoming chronically infected and creating the very problems they were meant to prevent. Tonsillectomy procedures rank among the most commonly performed surgeries worldwide, with hundreds of thousands of operations conducted annually. Surgeons remove tonsils through the mouth using specialized instruments, avoiding external incisions entirely. Modern techniques include electrocautery and ablation methods that use heat or radio frequency energy to extract tonsil tissue while minimizing bleeding and postoperative pain. These advanced approaches have made tonsillectomy safer and more comfortable than traditional scalpel methods used in previous decades. Current guidelines recommend tonsillectomy only after 7+ infections per year or sleep apnea, ensuring surgery addresses genuinely problematic situations rather than minor throat irritations. Enlarged or infected tonsils create significant breathing problems that extend far beyond simple throat discomfort. When tonsils swell, they narrow the airway passage, making normal breathing difficult during both waking hours and sleep. This obstruction frequently leads to sleep apnea, a serious condition where breathing repeatedly stops and starts throughout the night. Children with enlarged tonsils often snore loudly, sleep restlessly, and wake up tired despite spending adequate time in bed. Current 2025 statistics show excellent long-term outcomes for tonsillectomy patients, with most people experiencing dramatic improvements in breathing, sleep quality, and overall health. Recovery times have shortened significantly with modern surgical techniques, allowing patients to return to normal activities within 1 to 2 weeks rather than the longer recovery periods associated with older methods. Complications remain rare, though patients must follow specific postoperative care instructions to prevent bleeding and infection during healing. The immune system compensates remarkably well when tonsils are removed, though research reveals interesting trade-offs. Other lymphoid tissues throughout your body, including adenoids and various lymph nodes, effectively take over the tonsil's infection-fighting responsibilities. However, a Danish study shows adenoidectomy and tonsillectomy doubles upper respiratory infections without them, per Harvard research, indicating these tissues do provide some protective benefits despite their tendency to cause problems. Tonsillectomy techniques have evolved dramatically, with surgeons now using precise methods that reduce tissue damage and accelerate healing. Recovery protocols emphasize pain management and proper hydration, helping patients resume normal eating and speaking patterns quickly. These improvements have made tonsil removal far less traumatic than previous generations experienced. Tonsil removal often produces life-changing improvements, especially for children who struggled with chronic throat infections or sleep disruption. Parents frequently report that their children sleep better, get sick less often, and miss fewer school days after tonsillectomy. These quality-of-life enhancements demonstrate how removing problematic tonsils benefits overall health and development. New 2025 criteria for tonsillectomy focus on symptom severity and quality-of-life impact, rather than simple infection frequency. Alternative treatments may be considered, but surgery remains the most effective solution for truly problematic tonsils. While some organs handle single specialized functions, others take on multiple responsibilities simultaneously, creating more complex decisions about removal. Pancreas, partially the dual-function organ with backup plans. The pancreas handles both digestive enzyme production and insulin manufacturing, making it unique among organs because it performs 2 completely different jobs simultaneously. This elongated organ sits behind your stomach, quietly manufacturing the enzymes needed to break down food while also producing hormones that regulate blood sugar levels. Despite performing these seemingly essential dual functions, substantial portions of the pancreas can be removed when medical conditions threaten patient health, proving this multitasking organ has more capacity than most people actually need. Partial pancreatectomy procedures remove diseased sections of pancreatic tissue to treat conditions like pancreatic cancer, large cysts, or severe chronic pancreatitis. Surgeons carefully evaluate how much tissue they can safely remove while preserving enough healthy pancreas to maintain both digestive and hormonal functions. The location and extent of disease determine whether doctors remove the head, body, tail, or multiple sections of the organ. These operations require extreme precision because the pancreas sits near major blood vessels and connects to both the stomach and small intestine. The pancreas performs its dual functions through two distinct types of cells distributed throughout the organ. Acinar cells produce digestive enzymes including lipase, amylase, and protease that break down fats, starches, and proteins in food. Meanwhile, islet cells scattered throughout the pancreas manufacture insulin and other hormones that control blood glucose levels. Its dual roles mean surgery requires careful follow-up to manage both digestive and hormonal complications that result from reduced pancreatic capacity. Current 2025 statistics show encouraging outcomes for partial pancreatectomy patients, with minimally invasive laparoscopic and robotic-assisted techniques becoming increasingly common. These advanced surgical approaches result in reduced blood loss, shorter hospital stays, and faster recovery times compared to traditional open surgery methods. Patients with benign conditions or early-stage cancers particularly benefit from these less invasive procedures, experiencing fewer complications and quicker returns to normal activities. Enzyme replacement therapy becomes necessary after partial pancreatectomy because the remaining pancreatic tissue cannot produce adequate digestive enzymes. Patients take oral medications containing pancreatic enzymes with every meal to help digest fats, proteins, and carbohydrates properly. Doctors carefully adjust enzyme dosages based on individual needs and responses, ensuring adequate nutrient absorption while minimizing digestive symptoms like bloating and diarrhea. This therapy effectively replaces the missing digestive function, allowing normal food processing despite reduced pancreatic capacity. Insulin management requires equally careful attention when pancreatic removal affects hormone-producing cells. Partial pancreatectomy leads to diabetes in up to 40% of cases, requiring lifelong insulin therapy through injections or pumps. Regular blood glucose monitoring becomes essential to prevent dangerous fluctuations in sugar levels. The balance between enzyme replacement and insulin management requires constant adjustment as patients adapt to their reduced pancreatic function. People successfully adapt to life with partial pancreatic removal by following prescribed medication regimens and dietary modifications. They learn to coordinate enzyme supplements with meals and monitor blood sugar levels throughout the day. Many patients return to active lifestyles, work responsibilities, and social activities once they master managing their dual therapy requirements. New 2025 developments in continuous glucose monitoring and automated insulin delivery systems have made blood sugar management more precise and convenient than ever before. Advanced enzyme formulations provide better symptom control with fewer side effects. This dual-function organ demonstrates that the body can adapt to significantly reduced capacity when modern medical support replaces missing biological functions effectively, though some organs handle even more fundamental processes that seem impossible to work around. Colon, partially or fully, the waste management system with workarounds. The colon handles waste processing through a completely different biological approach, absorbing water from digested food and forming solid waste for elimination. Yet substantial portions or even the entire colon can be removed when medical conditions threaten patient health. This long tube connects your small intestine to your rectum, spending most of its time extracting water and electrolytes from liquid waste material flowing through your digestive tract. The colon transforms this liquid mixture into formed stool through a gradual dehydration process that seemed essential, until doctors discovered people could live normally without it. Colectomy procedures remove diseased sections of colon tissue to treat serious conditions including colon cancer, inflammatory bowel disease, and severe diverticulitis. Surgeons perform partial colectomies when disease affects only specific colon segments, while total colectomies remove the entire organ when conditions like ulcerative colitis or widespread cancer make partial removal insufficient. These operations require careful planning because the colon connects to multiple other digestive structures. Doctors must reroute intestinal connections after removing colon tissue, creating new pathways for waste elimination. The small intestine takes on additional responsibilities when colon tissue gets removed, though this adaptation varies significantly among patients. Following colectomy, the remaining digestive tract begins handling increased water absorption duties, essentially taking over functions the colon previously managed. This adaptation process takes several months to complete, with the extent of compensation depending on factors like age, overall health, and the specific surgical procedure performed. Current 2025 statistics show encouraging quality of life outcomes for colectomy patients, with minimally invasive laparoscopic and robotic-assisted techniques becoming standard practice. These advanced surgical approaches involve smaller incisions, resulting in reduced pain, faster recovery times, and lower complication rates compared to traditional open surgery methods. Patients resume diet within days and bowel function within weeks following segmental colectomy procedures. Those requiring total colectomy face greater lifestyle adjustments, but still achieve good long-term outcomes with proper management. Ostomy procedures create alternative waste elimination systems when normal pathways must be bypassed. Surgeons create openings in the abdominal wall called stomas, allowing waste to exit through external pouches rather than through the rectum. Modern ostomy pouches have evolved dramatically, featuring discreet, comfortable, odor-proof designs that allow active lifestyles. Ostomy care has advanced significantly by 2025, with improved pouching systems and comprehensive support services helping patients manage these systems effectively. Quality of life studies show most ostomy patients return to previous activity levels within months of surgery. Dietary adjustments become necessary after colon removal, requiring patients to modify eating habits and food choices to optimize digestion and elimination. People learn to eat smaller, more frequent meals and adjust fiber intake to promote regular bowel movements. Some patients require vitamin and mineral supplements to compensate for reduced nutrient absorption. Consulting with dietitians helps develop personalized eating plans that meet individual needs. People living with partial or complete colon removal maintain active, normal lives through proper management and adaptation strategies. They participate in sports, travel extensively, and pursue demanding careers while managing their modified digestive systems. Support groups provide valuable resources and emotional support for individuals adjusting to these changes. Modern medicine builds plumbing workarounds when pipes fail, proving the body can engineer effective solutions for seemingly essential biological functions. But some organs handle even more basic storage responsibilities that require completely different engineering approaches. Bladder, the storage tank with alternative solutions. The bladder handles urine collection and storage until you decide to empty it, but this organ can be completely removed with alternative drainage systems taking over waste elimination duties. Your bladder sits in your pelvis like a flexible container, expanding as urine flows down from your kidneys and contracting when you urinate. This storage system seemed absolutely necessary for normal life, until doctors discovered that engineered solutions could replace biological storage functions entirely. Cystectomy procedures involve removing the entire bladder when diseases like cancer, severe dysfunction, or chronic inflammation damage the organ beyond repair. Surgeons access the bladder through abdominal incisions, carefully disconnecting it from surrounding structures including the ureters that carry urine from the kidneys and the urethra that normally carries urine out of the body. The operation requires precise technique because the bladder connects to multiple organs and major blood vessels in the pelvic region. 5-year survival in bladder cancer cystectomy patients exceeds 60%, demonstrating the viability of this major surgical intervention. Urinary diversions redirect urine flow when the bladder gets removed, creating new pathways for waste elimination that bypass the missing storage organ. Surgeons construct these diversions using segments of the patient's own intestine, essentially repurposing digestive tissue to handle urinary functions. The redirected urine either exits through a stoma on the abdominal wall into external collection bags or gets stored in newly constructed internal pouches that patients empty manually. Current cystectomy procedures have become more sophisticated with minimally invasive laparoscopic and robotic-assisted techniques, reducing complications and speeding recovery times. These advanced surgical approaches involve smaller incisions, less blood loss, and faster healing compared to traditional open surgery methods. Patients typically spend shorter periods in hospitals and return to normal activities more quickly than previous generations of bladder removal patients. Different types of urinary diversions function as bladder alternatives through various approaches. Ileal conduits use small intestine segments to create permanent drainage channels that direct urine through abdominal openings into external pouches. These external systems require regular pouch changes, but offer reliable waste elimination with fewer complications. Neobladders involve constructing new internal storage pouches from intestinal tissue that connect directly to the urethra, allowing relatively normal urination patterns. However, neobladder patients may experience higher rates of urinary incontinence and require intermittent catheterization. The choice between these options involves quality-of-life trade-offs that patients discuss extensively with their surgical teams. The adaptation process requires patients to learn completely new waste management routines, depending on their specific urinary diversion type. People with external pouches master changing and caring for collection bags while maintaining active lifestyles. Those with neobladders learn specialized voiding techniques and develop skills through comprehensive education programs and ongoing medical support. Athletes, professionals, and active individuals demonstrate that maintaining demanding lifestyles remains possible after bladder removal through proper diversion management. They participate in sports, travel extensively, and pursue challenging careers while successfully managing their alternative urinary systems. New developments in urinary diversion techniques include improved materials for constructing internal pouches, advanced imaging for surgical planning, and innovative rehabilitation programs that help patients adapt more quickly to their new systems. This engineered plumbing proves that medical solutions can successfully replace biological functions, though some organs demonstrate even more remarkable recovery capabilities that seem to defy biological limitations entirely. Skin, partially, the body's largest organ with amazing healing powers. Skin covers your entire body like biological armor, representing the largest organ by surface area and demonstrating remarkable healing capabilities when substantial portions get damaged or removed. This organ stretches across roughly 20 square feet in adults, weighing about 8 pounds and serving as the primary barrier between your internal systems and the outside world. Despite its enormous size and seemingly essential protective role, people can lose massive skin areas through burns, injuries, or surgical removal, and still maintain normal body functions with proper medical treatment. Skin grafting procedures replace damaged or missing skin by transplanting healthy tissue from other body areas or donors onto affected regions. Surgeons harvest skin from donor sites, typically areas with abundant healthy tissue like the thighs or back, then carefully transplant these sections to cover wounds or burned areas. The transplanted skin establishes blood supply connections within days, gradually integrating with surrounding tissue to restore protective coverage. Split-thickness grafts use only the surface layers of skin, while full-thickness grafts include deeper layers for more complex reconstruction needs. The skin performs multiple critical functions beyond simple protection, including temperature regulation through sweat production and blood vessel dilation, sensation detection through specialized nerve endings, and vitamin D synthesis when exposed to sunlight. This organ also prevents water loss, blocks harmful ultraviolet radiation, and serves as the first defense against bacteria and other pathogens. The skin's complex structure includes multiple layers that work together to maintain these essential functions, even when substantial portions are damaged or removed. Current statistics show remarkable improvements in skin grafting success rates, with 95% full integration as per background research on burn care devices. Modern surgical techniques have reduced complications significantly, with advanced wound care protocols and infection prevention measures contributing to better outcomes. Recovery times have shortened as surgeons develop more precise grafting methods and patients receive enhanced post-operative care that promotes faster healing and tissue integration. Cryopreservation shelf life up to 5 years makes tissue banks critical for storing donor skin until needed for emergency procedures. Skin regenerates through complex cellular processes that activate immediately after injury, with specialized cells called keratinocytes rapidly dividing to replace damaged tissue. These keratinocytes drive reepithelialization within weeks, creating new surface layers that restore protective functions. The healing process involves multiple stages including inflammation, tissue formation, and remodeling that can continue for months after initial injury. Areas with good blood supply heal faster than those with limited circulation, though the skin's natural regenerative capacity often exceeds expectations even in challenging circumstances. Artificial skin and tissue engineering have revolutionized treatment options for severe cases where natural grafting proves insufficient or impossible. Scientists now create skin substitutes using various materials including collagen matrices, synthetic polymers, and cultured cells that provide temporary or permanent coverage for extensive wounds. These engineered solutions offer hope for burn survivors and others facing massive skin loss by providing protective barriers while natural healing processes restore function. Burn survivors demonstrate the skin's incredible resilience by recovering from injuries affecting 60% or more of their body surface area. These individuals often require multiple surgeries and extensive rehabilitation, but many return to normal activities and careers. Their recovery stories showcase how advanced medical care combined with the skin's natural healing abilities can overcome seemingly impossible odds. New developments in stem cell therapy, growth factor treatments, and bioengineered skin products continue expanding treatment possibilities for severe skin injuries. This largest organ proves that even the most visible parts of our anatomy contain backup systems and redundancies we never realized existed, though some body parts remain so obscure that most people don't even know they have them. Mesentery is the organ you never heard of that you don't need. The mesentery represents nature's forgotten organ, a thin fan-shaped membrane that connects your intestines to the back wall of your abdomen while holding everything in place like internal scaffolding. Most people go through life completely unaware this organ exists until a surgeon mentions removing part of it during abdominal surgery. This structure performs jobs that sound absolutely essential until you realize people function normally without substantial portions of it. In 2017, researchers officially classified the mesentery as an organ when scientists at the University of Limerick finally convinced the medical community that this structure deserved recognition as a distinct organ rather than fragmented tissue. This recent classification means we're still discovering what the mesentery actually does and how important it really is for normal body function. The reclassification has sparked increased research into mesenteric functions and their role in digestive health, though much remains unknown about this newly recognized organ. The mesentery performs two main responsibilities within your abdominal cavity. This organ supports your intestines by anchoring them to your abdominal wall, preventing them from floating around freely inside your belly. It also contains the blood vessels that supply your intestines with oxygen and nutrients, acting like a biological highway system carrying vital supplies to your digestive tract. The mesentery houses lymphatic vessels and nerves that coordinate intestinal functions, making it seem like removing any portion would cause serious problems. Mesenteric resection procedures happen frequently during surgeries for colon cancer, Crohn's disease, and other abdominal conditions when surgeons need to remove diseased tissue along with its supporting structures. Doctors carefully plan these procedures to preserve as much healthy mesentery as possible while eliminating problematic areas. Modern laparoscopic techniques allow surgeons to perform these resections through small incisions rather than large abdominal cuts, reducing recovery times and complications compared to traditional open surgery approaches. Current data on mesentery resections shows minimal impact on most patients, with people maintaining normal intestinal function despite having reduced mesenteric support. Recovery protocols have improved significantly, with patients typically resuming regular diets within weeks of surgery. The extent of adaptation varies depending on how much mesentery gets removed and the specific location of the resection, but most people adjust well to their modified abdominal architecture. Your intestines demonstrate remarkable flexibility when forced to function with reduced mesenteric support, adapting to changes in blood supply and structural support through alternative pathways. The remaining mesentery often expands its coverage area, while other abdominal structures help stabilize the intestines. This adaptation process usually takes several months to complete, during which patients may experience temporary digestive adjustments before achieving normal function. People adapt successfully to partial mesentery removal during other abdominal surgeries, often without realizing this organ was even involved in their procedures. The adaptation typically involves minor dietary adjustments and occasionally requires medications to manage temporary digestive changes. Most patients return to normal eating patterns and activities within months of surgery. New research continues exploring the mesentery's hypothesized immunological role and its functions in gut microbiome management, though the practical implications remain unclear. This mysterious organ proves our bodies contain structures we're still figuring out, revealing just how many biological components we carry around without ever knowing they exist. These discoveries demonstrate that your body operates like a biological Swiss Army knife, packed with way more tools than you actually need for survival. Modern 2025 medicine has revealed that human redundancy systems are more extensive than anyone previously imagined, with evolution building backup systems evidenced by studies in appendix, liver, kidney, and dozens of other organs. From half-brains to spare kidneys, medical data confirms extensive redundancy throughout our anatomy that allows remarkable adaptation when parts get removed. The fact that you can lose entire organs and substantial body parts while still living normally proves evolution designed us with multiple contingency plans. Scientific research continues unveiling surprises in our anatomy, showing just how many biological components we carry around as optional equipment rather than essential hardware. What surprised you most about these expendable organs? Drop a comment below sharing which organ shocked you, and don't forget to share this video with anyone who thinks they need all their body parts to survive.